Thanks for logging into our shoulder pain webinar. Sorry you couldn't attend our live shoulder pain workshop, but we'll be going over the same material just in a condensed format here. So we're going to be going over the top causes of shoulder pain. We'll be going over the biggest mistakes people with shoulder pain make. And we're going to go over a little bit of shoulder anatomy today just to give you a little bit more of a background. Let's get started. So just to start, my name is Mark Frasco. I'm a physical therapist here at Myron Marsh. And I've been here for a little bit over a year. Grew up over in New Jersey, and I moved to Utah about a year ago. But I'm a physical therapist, and I'm a strength and conditioning specialist. And I really love treating the shoulder, and I really love, learning more about the shoulder and specializing in the shoulder. So that's the main thing I work on. We also treat a variety of other conditions: lower back, neck pain, ankle pain, foot pain, but I primarily like treating the shoulder, and I see mostly shoulder pain patients here. And just a little bit of background, I mainly got into working with the shoulder just from prior injuries. Growing up in high school, I was a baseball pitcher. I was ambitious, and I was looking forward to pitching in college, but um, my sports career got derailed a little bit through shoulder injuries, and I didn't have the proper treatment I needed, and that really sparked me to grow an interest in learning more about shoulder pain and the treatment for shoulder pain, really. So it's kind of a little bit of a background for me, but let's kind of dive deeper a little bit. Let's just start with a little bit of anatomy, and I want to start with the rotator cuff because I think it's one of the most misunderstood tissues in the body. So when we talk about the rotator cuff, most people think that the rotator cuff is this, elastic band or this solid tissue in the shoulder. But it's actually a lot more dynamic than that. The rotator cuff actually is a series of four muscles. It's a group of four muscles, and they attach to your shoulder blade, as you can see here, and they go all the way across onto your arm bone. So right up there at the top of the arm. And it's four muscles, and they work like any other muscles. They shorten and they move the arm in each direction, overhead, behind your back, to the side. And they're the primary stabilizers and the primary movers of the shoulder joint itself. And again, their job is to help you move your arm in all directions. On top of that, there's four other areas that work together to create the shoulder movement that you see. So the first area is the neck. The second area is the shoulder blade. The third area is the collarbone, and the fourth area is the rib cage. So all of these areas in the body have to be working properly and have enough motion for your arm to move all the way overhead and behind your back, like I said. So one of the biggest things is the shoulder blade itself. So the shoulder blade, as you can see, sits on your back, and it sits on the ribs right in here. So that shoulder blade has to move with your arm in order to get full motion. If there's a problem in that shoulder blade bone and movement itself, you're not going to have full arm motion overhead or to the side. Same thing goes with the rib cage. Your rib cage really influences your shoulder blade itself. So if you have poor posture, or if those joints on the ribs itself don't move, it's going to inhibit your shoulder blade and your arm motion as well. And the same thing can go for the collarbone. So as you can see here in the front, your collarbone, or the clavicle, attaches your shoulder blade to the front and right into the sternum. So that's the attachment that the shoulder has to the front, right there on your sternum. So if that collarbone is stiff and it doesn't move, that's also going to affect how your arm moves in the air. So those three things especially affect how your arm moves. You may not think about it, but your rib cage, your collarbone, and your shoulder blade all really play an important part in your arm movement. And the last thing here is your neck. So if you have any restrictions in your neck or any loss of motion, that's also going to affect how your arm moves. You may have some tightness here, which affects the range of motion in your arm. You could also have a pinched nerve that may be sending some weakness or some pain down in your arm and limiting your shoulder movement. So those four areas really are um, key, and they work hand in hand with the arm itself. So when you're having pain, the biggest thing you want to understand is if your pain is reproducible. Think about what day-to-day activities make your pain worse or bring on your pain. Things like carrying objects, lifting weights off the floor, reaching overhead into a cabinet, or reaching behind your back to put on clothes, or even sleeping if you're having pain while you sleep. And the biggest thing to know is that if your pain is reproducible, there's a cause to your pain, and the pain can then become reducible. And the biggest thing we do here at physical therapy is that we determine what structures and what activities are producing your pain, and we can figure out a plan to reproduce that pain. So think about it, what day-to-day activities, what things really bring on your pain and really make your pain worse. And leading into that, there's three ways that people can handle pain. So the first way you can handle pain is you can ignore it. So this typically sounds like excuses. So, and this is the majority of people, we have little aches and pains and we ignore it, we excuse it and we hope it goes away. The second thing we can do is we can try and alternate. If we first ignore it, we hope it goes away and it doesn't, most people then try to alter it. You take some Tylenol, you take drugs, you get a cortisone injection, and you just try and alter the pain. You try and mask the pain, really, rather than, seeing what is the main cause of the pain. And that leads me to the third thing is you can do something about it. So, again, you can ignore it, you can try and alter it or mask the pain, or really you can find the root cause and you can do something about it. And then, obviously, the biggest mistake with people with shoulder pain make is that they ignore their pain. So, as I said before, most people will ignore their shoulder pain, and over time, they start favoring their other arm. Their shoulder starts to get really tight, and before you know it, they've ignored it and masked it for so long that your motion and your strength is so limited that you barely have any function. So that is the biggest mistake people make. Let's go ahead. Let's talk about the most common causes of shoulder pain. And I want to start by talking about shoulder impingement. Many people may have heard this term before, but shoulder impingement really means that the tendons that run through your shoulder blade are getting impinged on the bones of the shoulder blade and the arm bone up top. So if you look to the right here, you can see that a tendon of your rotator cuff up here and your biceps tendon, they attach deep into the shoulder joint itself. And when you have decreased space in between those bones, in between the shoulder blade and the arm, what can happen is those tendons can start to get impinged and start to become inflamed when you move your arm. So really the bottom line is that there's a decreased space in your joint, and the tendons are getting impinged and inflamed every time you move your arm. So typically people with this impingement problem have pain reaching overhead or behind your back, movements where the spaces in the joint compress and they start pinching on that tendon of the rotator cuff and the tendon of the biceps. So the next common cause is usually a problem in the neck. And this is where having a professional look at your shoulder really comes in play, because a lot of times people won't realize that a lot of their shoulder pain and weakness is coming from the nerves of your neck. So if you look to the left here, all the nerves from your spinal cord exit right there in your neck, and they run all the way down your arm. And those are the nerves that innervate your shoulder, your bicep, your wrist, and your hand. Those nerves create the movement and the strength that we have. Now, you may be having a pinched nerve or an obstruction of one of the nerves in your neck, which is causing some weakness and some movement restrictions in your shoulder. So it's really important that we take a look at the neck and make sure that it's not a nerve-related issue, it's actually a shoulder joint issue as well. Another big common cause of shoulder pain is poor posture. So another thing people don't realize, but posture really affects the shoulder joint. So if you're curved like this little guy here and your shoulders are hunched forward, it really affects the entire mechanics of the shoulder joint. So you become really tight in the front and you become really weak in your muscles in your back. And in that position, your shoulder blade just won't move properly. As I said earlier, if you don't have that proper shoulder blade movement, that arm's not going to move overhead like you want it to. So another big reason for shoulder pain is just this poor posture, just altering all the mechanics of the shoulder joint itself. And another common cause is osteoarthritis. So this is a term that many of us have heard before. But really what osteoarthritis means in Latin is joint inflammation. And really what it means is that there's inflammation around the joint because there's something that's mechanically altering the joint itself, whether it be weakness, whether it be lack of joint space, whether it be motion restrictions. Just means there's a lot of inflammation in that joint, maybe some wear and tear from aging. But to find out, you have to determine the cause, your deficits in your shoulder to really figure out what's causing that inflammation and that arthritis. Okay, so again, common causes are shoulder impingement, neck problems, poor posture, and osteoarthritis. Those are the main kind of causes of shoulder pain. There's other things such as traumatic injuries, such as a fall or a tear, that we treat as well, but those are really the common ones. But next, let's go into what successful treatment looks like. So successful treatment really is a sequential steps. So we have phase 1, phase 2, and phase 3. So when you come in, we'll start you on phase 1, which is really regaining motion. Phase 2 will be restoring any strength or any muscle deficits. And phase 3 will really be, final push, getting you back to your normal functions and activities that you want to do. So first motion, second strength, 3 is function activities. And how we progress you through those 3 phases really is a sequence of hands-on treatment, in addition to exercise, which is strengthening, stretching, and muscle memory exercises. And in addition to that, modalities for pain, such as a deep tissue laser, a TENS unit, ice and heat. And all those 3 elements combined really make successful treatment. If you're lacking in one of those categories, you're not going to get the progress you want to see as fast as you want. So that being said, the best thing you can do if you're having shoulder pain right now is really to see a professional, is to do something about it, to have a professional look at your shoulder and determine what is really going on in the joint. So, simply put, the next thing you can do is call our office and get in for an evaluation and start your path to recovery today. So thank you again. Thanks for listening. I know it's more of a short and condensed version, but if you're interested in coming in for an evaluation, just give us a call or send me an email, and we'll get you started today. All righty.